Hi, everyone, and I agree with Heather. I think a gift could be for us to give you back some time as we are all getting ready for the Thanksgiving holidays. Um, I'm going to jump right in with our Friday Facts interview with Elaine Whitford. So I'm going to give a little background for those who may not know Elaine. Um, she is the executive director of the Center for Volunteer Caregiving. She joined the center in June 2018, bringing 20 plus years of nonprofit leadership. Immediately before joining the center, she was the director of development at Disability Rights North Carolina, which I know everybody is familiar with, and we are thrilled that they are members of our coalition. Um, as a volunteer and professional, Elaine has led many successful nonprofit communications, development, and events activities. She has served on multiple nonprofit boards in the Wake County community. And for those of you who may not know, the Center for Volunteer Caregiving does serve Wake County. Elaine is an enthusiastic proponent of the center's volunteer services, which support the growing needs of Wake County older adults, family caregivers, and adults with disabilities who are living independently. She graduated from the University of North Carolina at Chapel Hill. I'm sure some people might be familiar with that university. She got a bachelor's degree in economics and then received her Juris Doctorate from UNC School of Law. So welcome, Elaine, to Friday Fact.
Thank you.
So as you know, and as I think the people on this call and most of our members know, what we love about Friday Facts is it's our sort of laid back, casual way of getting to know members and organizations that work in the serious illness or caregiving space. And as Heather mentioned, I'm thrilled that you agreed to be interviewed during National Family Caregivers Month. So let's jump in. We want to hear a little bit about your background. So if you don't mind, tell us where you grew up, where you went. Well, we know where you went to school, but you can even tell us where you went to elementary school if you'd like.
Well, I was actually born in Germany because my dad was in the service at the time. But both of my parents are from Eastern North Carolina. So we quickly got back to the United States, and I've lived in North Carolina for most of my life. There have been a few years where I was somewhere else, but this is definitely home. And I have lived in Raleigh for almost 30 years now. So not born and bred in Raleigh, but definitely feel like I belong here.
Oh, that's great. So you are. So this is basically home.
It is.
That's good. Um, and then tell us a little bit about how you so you grew up in North Carolina. I know you've lived in some other places in the US. How did tell us a little bit about the path that you took and your experiences that got you we're not going to get to the Center for Volunteer Caregiving yet, but you told me some of your background and your law degree and things like that. We'd like to hear about what you did in the legal profession first.
Sure. So I had 4 wonderful years of undergrad at UNC Chapel Hill, and I couldn't tear myself away. So I had to go to law school to have 3 more years. But my parents believe I was really designed for a lawyer because I could always stir up a debate. I won't say an argument, a debate. Of course, in high school, I was the president of the debate team, which people who know me find that not to be shocking at all. Right after I graduated from law school, I got married, and my now ex husband, his job was in Pittsburgh, Pennsylvania. So I immediately moved to Pittsburgh, Pennsylvania, and took the Pennsylvania bar. And when I was in Pennsylvania, started working with a small boutique law firm that represented public school systems. And I was initially licensed to practice in 1989. And in 1990, the Individuals with Disabilities Education Act was enacted. And the school systems that we represented all turned to us and said, "What is this? And what does it mean for how we educate children with disabilities?" So, in my practice of law, I really walked side by side with school systems and trying to figure out what the IDEA was. Of course, I immediately realized how pro child the law was, which I'm 100% behind. Even though children's counsel in my early years of practice like to refer to us as the evil empire, I always thought that I was representing the interest of the children and explaining to the school systems what they needed to do. Of course, it was hard for them early on because, you know, it's an unfunded mandate, but we've come a long way since 1990. So when I moved back to North Carolina, I joined Tharrington Smith in their education law practice and continued to do a lot of special education work. But while I was a lawyer, I spent hours and hours and hours working with nonprofits, volunteering, being on nonprofit boards. And after 16 years of practicing law, being a partner in 2 law firms, I realized that those nonprofit emails were the ones I was looking at first in the morning. And then I would get down to the business of practicing law and bill some hours. And I thought, you know what, life is too short to be doing something that is not what gets me up in the morning. I need to do that. So I just stopped practicing law, kind of flipped all my volunteer experience on its head and said, I'm available to consult. And within 2 weeks, I had 3 nonprofit consulting jobs and just sort of took off from there. After a couple of years, I realized it's easier to fundraise for one organization than multiple. So I decided going on staff was the right move. And I was working with a small environmental nonprofit when the development job at Disability Rights North Carolina opened up. And I thought, wow, that is designed for me because I have development experience. I want to continue to develop fundraising experience, but I speak lawyer speak. I will understand what this group at Disability Rights is doing. So I was there for 8 years before I came over here at the Center for Volunteer Caregiving as executive director.
It, I loved what you said the other day when we were talking about that you were one of the few people who read what was the document you said you actually dug into?
Oh, I love a contract. I mean, give me pages and pages of contracts. My friends are like, I have a friend who's trying to get her mother out of a timeshare and they're sending her all these contracts. And she said, I'm cross eyed. I was like, send them to me, send them to me. I love a contract. I mean,
I just thought that was really funny. And thinking about how, there are probably people that are going to listen to this and go, maybe I better get in. We may have, I may have messed up your next few weeks of work life if people say, oh, Elaine might be the exact person I need to read this. But so I
yeah.
apologize about that. But
Well, for this group, I will reveal that, like I said, I love a contract. My license is still active, and I use it almost on a daily basis. But I give a lot of free legal advice, which I am happy to do for those doing good work in the nonprofit and volunteer world. So uh, my email is probably floating around in this somewhere, and don't hesitate to reach out. And if it's something that's out of my realm of expertise, I'll immediately tell you. But I can also tell you who to talk to.
And that brings me to something I forgot to mention earlier. If everyone would, if you can, please put your name and your affiliation in the chat. That way we can kind of see who, and Elaine can see who's on the call. And if you have any questions for Elaine, certainly feel free to put them in the chat, or we'll open it up to questions at the end. But and Elaine, after we're done, you're welcome if you would like to put your email in the chat. So now's the time where we can get into your current work. Yeah, tell us a little bit about the Center for Volunteer Caregiving, what services you offer, and then anything in particular you'd like to highlight that you think the members of the Serious Illness Coalition would that anything that would resonate with them.
So the Center for Volunteer Caregiving, I think, is Wake County's best kept secret. I run across people all the time who tell me they had no idea there was such an agency. And I think it's because we're unique. We're the only agency like us in North Carolina, and there's really only a handful across the country. We've been around for 33 years. We were founded in 1992. And if you think about 1992, if you had an email address, it was AOL. If you had documents, they were on the 5-inch floppy. I don't even think we'd gone to the smaller hard disk yet. So technology was obviously starting to evolve, but wasn't quite there yet. And it was more difficult for communities of faith to run their own volunteer caregiving programs. So a congregant from the First United Methodist Church of Cary had gone to an AARP conference and heard a representative of the Robert Wood Johnson Foundation talk about a project called Faith in Action. And they were providing seed money to communities to create their own volunteer caregiving organizations in the community. So John Mears Sr. brought the idea back. A group in Wake County got together and said, we need an organization like this to help our communities of faith run these programs. So we were really built as an economy of scale. But technology started taking off, and I don't know exactly when in our history it happened, but I think it was pretty quickly. We evolved into more of a community-based program. So while we still have supporters and affiliations, liaisons with some communities of faith in Wake County, by and large, we are drawing from the community, both in terms of volunteers and referrals for clients. So the center has 3 core programs. Our biggest program is what we call in-home connections. And the biggest service in that is our friendly visits. So we're focused on older adults, primarily 60 and older, who are aging in place. So they're still living independently in their own home or apartment. We do not go into nursing homes or assisted living. And our goal is to help break up the isolation and the depression that comes with aging. When you become less mobile, maybe you're no longer driving, your friends are moving away or passing away. And so we want to make sure that older adults have friends, that somebody pops in to visit them. There's statistics about how many older adults can go a whole week without talking to one other live person. And it's pretty staggering. So that's the core. We do have a helping hand program where we'll do a little light things around the house, like take out the garbage or change a bed sheet, things that become more difficult as you age. But the core of that program is really the friendly visits, getting a volunteer out to visit somebody. The program that is in hot demand right now is our volunteer driver escorted transportation program. So we're focused on access to healthcare and access to basic needs. We're not a general transport program. We'll take you to a medical appointment, dental, grocery store, pharmacy. And every now and then we'll take you to the DMV if you need to renew your ID. And in the big voting years, we also take people to vote, because I'm a firm believer that we all have a right to exercise our right to vote. It doesn't matter what your vote is going to be. We want to make sure you get to the polls to be able to do that. Our transportation is escorted. So our volunteer drivers use their own vehicles, pick up our folks, take care of them, make sure they get safely to and from wherever they're going, and then get back home. So it doesn't operate like Uber. It's very much escorted, which is why it's in such hot demand. We have a waiting list right now of about 150 people just to enroll in transportation. We did over 1,300 round trip rides last year. So we're just seeing a huge demand for that program. And then the smallest program, which is the one that's pertinent for this month, is our caregiver respite program. So that's where we send a volunteer to the home of a family caregiver who just needs a break, doesn't have other support, or has less than 10 hours of paid in-home care. And they just need self-care. They need time to get away. And that could be anything they want to do other than work. We don't provide respite for them to go to work, but it could be to go to their own medical appointment, have lunch with a friend, go play pickleball, or go to a bunco game, or go in the backyard and garden. But they know that their loved one is with the volunteer and is not going to be in harm's way while they're focused on themselves for 3 to 4 hours. Um, all of our programs are provided by volunteers. We never charge. We are 501(c)(3), so donations are always accepted. But all of our services are free. Last year, our volunteers provided 12,500 hours of services. That's across all of our programs. In the caregiver respite program in particular, it was about 2,000 hours of services, and we served, I think it was 51 family caregivers in that program.
That's incredible. I sorry, I was taking notes because I'm really intrigued with how much time and how many. Do you have a number of how many volunteers you have that you draw from regularly?
Yeah. So last year, of course, volunteers come and go, which is just part of the game. But last year, that 12,500 hours of services was provided by 301 volunteers. And often when I'm speaking about our program and I say, we had 250, 300 volunteers, and people are like, oh, you're good. You don't need any more. Well, we are getting an average of about 75 new client referrals every single month. Our tiny little nonprofit here is we're getting referrals from United Healthcare, Humana, Anthem, Aetna. We're getting them from all the local hospitals, Duke, UNC, Wake Med, all of their home care, home med programs, their social workers, their care coordinators. They all know about us. They're sending people our way. Home care companies, when someone reaches out to them and can't afford the $30 to $35 an hour, they refer them to us. This is the time of year when a lot of people on those Medicare plans and Medicaid plans who have transportation, but now they've used up their 24 one-way rides for the year, they start sending them to us, which I think is part of why we have so many people on the wait list. Um, our wait list for transportation is segmented in certain parts of the county. So as we get more volunteers in a part of the county, or we have some clients who rotate off of the service, we'll onboard more people. Um, I think because we're based in Cary, it just happens to be where our office is. And I also think there's a lot of retirees in Cary. We have a solid base of volunteer drivers in Cary. So if you're in Cary, Apex, or the 27606, which is the kind of the western edge of Raleigh, we can onboard you immediately. So there's actually no wait list for transportation. For caregiver respite and all of the in-home connection services, there's no wait list. We will enroll someone as quickly as we can get out and do an in-home assessment, which is usually within a week or two. But then the question is finding the right volunteer for them. So our transportation is done on a shift basis. We have this really cool online portal where our volunteers can go in, see all the rides requested, self-assign a ride. They get an automatic email, which is super great. For in-home services and caregiver respite, we do a one-to-one match with a volunteer to a person or family. And over the years, we've realized that that is a great way to allow them to develop a relationship and build a bond. And a lot of our people realize they become friends, even though they started as a volunteer. We have one volunteer, and we've recognized her a year after year for this, but she has now been with the same lady, friendly visiting, for 18 years.
Wow.
We have another volunteer who had been with her lady for 15 years, but Miriam had to move to Florida to be closer to family. So, because we do that one to one match, we really allow them to establish a relationship. And that's what got us through the pandemic. During, what was it, March of 2020, when everything started shutting down, I thought, uh oh, we're in trouble. We're in big trouble. And what I saw was our volunteers really stepped up to the mat and said, this is my family. I mean, we may not be related by blood, but this is my lady or this is my gentleman, and I'm not leaving them. I mean, there may have been a couple of months where in person visits became phone calls, but it was really June when most of our folks were back visiting in person with their people. Of course, wearing masks, doing social distancing, doing everything we all did. But allowing our volunteers and the people we're serving to develop that close friendship and relationship, I really think is one of the cores, pillars of our program and keeps us going.
That's incredible, and it's also really interesting to hear about how that went during COVID, because I think that's you automatically go to that and think, oh, that must have been really difficult. But your point is valid. If people were already there and having relationships, it's just like family members coming in. Before I don't want to stop. I think this was all very interesting. I do want to ask you to tell a little bit about the volunteer respite consortium that you are leading, because again, I think that's something of interest to the members of this group.
Yeah. So a few years ago, the state wrote into the Lifespan Respite grant to develop ways to bring people together to facilitate uh, creative opportunities for respite for family caregivers. And they were aware of our program and reached out to us to see if we would be willing to lead the establishment of a statewide coalition of volunteer respite programs. The idea being the existing programs, we want to share ideas, support each other, help each other troubleshoot, but we also want to facilitate the development of new programs across the state. So we pulled together a steering committee with representatives, Western North Carolina, Eastern North Carolina, Middle, and then we started looking for the existing volunteer respite programs, which was way more challenging than I thought it was going to be. And we eventually just started meeting, and we just learn of new programs and invite them to join us. Of course, it's all free. There's no charge. It's a super supportive group. We meet about 5 times a year now, all through Zoom. We tried an in-person meeting, but everybody's all over the state, so doing it online is really the easiest thing for everybody. But we had a meeting where one of our programs that has a current respite program, the day before the meeting, they had received a call from their insurance company that they were not going to cover them anymore. And so, as a group, we brainstormed where they were going to go to find insurance. So, just a small example of things, we have educational opportunities. We do trainings on liability. In January, our meeting is going to be focused on evaluating volunteer respite programs. And our focus, the consortium is open to any volunteer respite program or any program interested in developing a volunteer respite program. And we put them on a list, and they get invited to the meeting. So it's wide open. If you know of a program or somebody interested in volunteer respite, connect them with me. We'll get them on the list so they get the invite for the January meeting, and we'd love to have them. So it's really just a like-minded people. We've got programs across the state that are doing respite like we are, sending people into the home. But something that I've seen recently is the development of more volunteer day programs. So respite where the caregiver brings the care recipient to a location, and there's group respite provided while the caregiver gets a break. And I think almost all of those are being provided in a church or community of faith site. Um, so different programs. Right now, everybody who is a part of the consortium is serving older adults or people with serious illness, but we're also open to people providing respite for uh, parents taking care of children with disabilities. We just haven't found a volunteer respite program in that, but we're wide open to it. On our website, there's a page dedicated to the consortium, reviews what our goals are, purposes. If you're a consortium member, there's sort of a hidden page with a very simple password. We record all of our meetings so people have access to it. I'll post if there's a funding opportunity for someone, post that on there. So our consortium members have a landing page for information as well.
That's good. I put in the chat for those who are interested. I did put the website for the center on there, and then I while you were mentioning the consortium page, I went ahead and copied that. So those are in the chat now for
Great.
anyone who's interested. I'm going to ask you just a few more questions, and then I'm going to open it up because you and I talked about this, and you've got me intrigued about something. So I'm going to give you easy. Heather, I didn't even tell you I was going to do this, but I did this on another Friday Facts, and I love it. But I'm calling it my rapid fire questions because I think they're fun. So I'm going to give you easy ones, and then I think you know the last one I'm going to ask you. But what's your favorite season?
Spring.
Okay. That's I feel like that's an easy one here. Most people say spring or fall and that's probably everywhere, but I feel like North Carolina rarely does somebody say summer. Are you a morning person or a night owl?
I am such a night owl.
And that's great because we have to have all kinds. I was joking with someone the other day that yeah, I'm a night owl till about 9 o'clock.
No, I could be exhausted, and around 10 p.m. I catch a second wind. I could stay up all night. I blame my parents because they were not morning people, and as a baby, they kept me up so that I would not wake them up early in the morning. And it literally, like, I tried to work out in the mornings and felt sick for the rest of the day. And I was like, I'm such a night owl. And I have 5 full-time staff members here at the center, me being one of them. Everybody else here is a morning person. They are all in here, like somebody is usually in here before 8 o'clock in the morning, and then I'll kind of come rolling in sleepily around 9:30 and blink, blink. They're all here working away.
And then but you said then you work a little later. So it's great. You have that
Right,
balance, right? You
right.
have that then everybody's covering something. Okay, last question, and the one since we talked the other day, the one I've been wondering about. Hidden talents or hobbies?
So when I was younger, I was a dancer, and I even danced in the Chapel Hill City Ballet Company. And so dance followed me forever because I love it. And so while I'm not doing it right now, my hobby for like 15 years was uh, ballroom dancing. And of course, my friends laugh because every hobby of mine turns into a competition. So I competed in pro-am competitions with my instructor. And I was doing ballroom dancing before Dancing with the Stars started. So a lot of those professionals, I competed against them with their students at competitions, and in fact, were judged by some of them in competitions. So I'm like, I was ahead of the Dancing with the Stars ballroom dancing. I was doing it before it hit TV.
Wow. Next question. Are there any videos that we might be able to find of you online?
There are videos, but I don't think they're online. I think they're
Okay.
all on a disc at my house.
So we'll have to bribe you somehow to get those to well, maybe we have another event, a
A show and
coalition
tell.
event. Yeah. Everybody gets to show their secret talent. I want to open it up to the group for any additional questions. Those were my questions. Any other questions for Elaine while we have her here? She'll be on for a while if you think of any other ones. And you can come off mute, or you can put the question in the chat.
This is Sandra with the Coalition on Aging. Just thank you for the information. It's amazing because the travel part you were talking about earlier, and I know this is the caregiving that is part of it, but that's the one thing. My mother lives in a very rural area, so there are no other opportunities. There's no bus service, there's no taxi cabs. I'm not even sure if there's anybody around there that does Uber because it's 30 minutes from nowhere already. So it's interesting to me how in in a more urban area you have such a wait list. I can only imagine what it would be like in an area like that, especially as those smaller communities like she lives in, the folks who did drive are either not driving themselves now or they've passed away, unfortunately. So I think this is something that really needs to be brought to the forefront. And a lot of it does fall to the caregiver, family caregiver, in providing that. But thank you for doing that in the areas you're doing, because that is, as you know, one of those services that's desperately needed.
Yeah. As a part of our transportation program, our coordinator, and sometimes I pop in and attend, but we attend the Transportation Advisory Board committee meetings in Wake County, as well as CAMPO, which is the Capital Area Metropolitan Planning Organization. They have a group that's very focused on transportation. We attend all of the meetings. So they're all very aware of where the transportation deserts are and the challenges for older adults and people with disabilities with transportation. We have Go Wake Access, which is a great service, but it just can't meet all the needs. Or, we've got people who need to go to Durham for medical care, and Go Wake Access doesn't take them to Durham. So in those cases, we're the answer. So we're at the table with the very large providers. We're a small fry compared to them, but we have such a unique service that kind of fills in a gap. But we are constantly recruiting and looking for new volunteers who are willing to drive, primarily on weekdays. It's a great gig for a new retiree.
Elaine, it's Mary Bethel, and I'm sorry you can't see me. I'm sitting in a parking lot someplace. But I had a question. Thank you guys, first of all, for what you do. It's such a great service for Wake County. But how many people or organizations or agencies are in the consortium that you guys are working with?
We currently have, I think it's 19 groups, and 21 people or 22 people are part of the consortium.
That's great.
And it is statewide.
Super. And pretty much even distribution across the state, or are you primarily?
It's pretty even. We've got representation in Asheville, Burnsville, Wilmington, Burgaw, Winston, Greensboro, Kernersville, I think Statesville, the Charlotte area, of course, us in the Raleigh area.
So you mentioned, great. So you mentioned that a lot of churches are sites for things, but are you finding that churches are the primary providers of this volunteer respite and things like that?
The members of the consortium, we actually only have one person who's a member of a community of faith. Everybody else is either part of a government agency like a AAA or a nonprofit. There's a couple of the villages, if you're familiar with that concept. It's sort of what we do on a more of a neighborhood microcosm, but neighborhoods coming together and creating sort of a volunteer program to help older adults. So there's a few of the villages across the state. But they all do different things. And some are part of the consortium because they want to create a respite program and they don't have one, or maybe they had one, but they lost the volunteers or lost momentum for it. So we talk a lot about where do you find volunteers, which is the $10 million question, and how do you keep them?
Right. Last question. Are most of the programs that are doing volunteer respite that are part of the consortium, are they older adults in general, or do you find a lot that are focusing on persons with dementia or things like that, or is it really just really vary?
It's varied. It's varied.
Right.
It's pretty wide open.
Super. Thanks. Appreciate
And
all you
we,
do.
in our respite program for the volunteer respite, I would say about 50% of our current clients are taking care of someone with Alzheimer's or dementia, and the other 50% is post-stroke, just age. I mean, I just onboarded a new client who's taking care of her mother who's 95 and just doesn't get around as well as she used to. She's also post-stroke. And then folks with advanced stages of cancer, taking care of a loved one in that stage. So it's kind of 50% dementia, Alzheimer, 50% sort of everything else.
Right.
And I do want to add, I didn't mention it before, but as a part of our caregiver, we call it caregiver support, our staff actually provide a lot of support in that program, maybe more so than the transportation and in-home connections. I've had a MSW coordinating that program. She just left last week, so I have a vacancy in my caregiver respite, caregiver support program coordinator position. Actively recruiting if anybody's available or knows someone. We've got a great little team here. But we check in with our caregivers regularly. We also offer Powerful Tools for Caregivers, which is an evidence-based class. I have 3 staff members who are trained, including myself, because we have to co-lead it. That's part of the program protocols. But it's a 6-week, it's about an hour and a half a week. It is live. It's not a support group. It's really focused on giving the caregiver some tools to help make it a little less challenging and to get them to focus on themselves and taking care of themselves. Because you have to take care of yourself to be able to take care of someone else. We've been running that Powerful Tools for Caregivers program, I think about 18 years now, 17, 18 years, certainly before I got here. It's very well received. Our next class is going to start in mid-February, and it Crossroads Fellowship, which is a community of faith in North Raleigh, is giving us space to run it. And that one, it's actually going to be an evening class starting at 6 p.m. I've got information posted on the website, but I also have a flyer that I can send out if anybody knows someone that would benefit. We're enrolling people for it. It's a small group. We cannot have more than 14 people, and we typically have 10 or 11 in each class. And everybody there is a family caregiver.
That's great. Thank you, Elaine. And I want to just offer anyone else final question. I saw a couple people come off mute. I didn't see who it was, but if anyone has another question, we'll do one more question and then we'll wrap up. Maybe not. Okay. Well, Elaine, thank you so much for letting us speak with you, especially on this National Family Caregivers Month. And thank you for all you do. As you heard, there's a lot of gratefulness in the area for what you do. We know it's hard work, and we also know the challenges of especially getting volunteers. So we really appreciate that that part of that challenging part of caregiving. And thank you for telling us about the center. Thank you for telling us about your background, and you're welcome to stay on. If you can't, we understand. We know you have a lot going on, but I'll just let you, if you'd like to put your information in the chat, and then if anyone else has any questions for Elaine, feel free to put them in the chat, or if she's still on, we can certainly ask any questions as we wrap up here.
Thank you for the opportunity to talk to you about our program. I will put my information in the chat, and I'm always open for emails and phone calls. We like to talk to people here, so don't hesitate. Don't be a stranger. It's North Carolina. Nobody's a stranger.
Yeah, agreed.
Thank you so much.
Thanks, Elaine.